The ancestors of today's collies worked as herding dogs in the Scottish Highlands, driving cattle and sheep to the market. They may take their name from a Scottish breed of black-faced sheep, also called the collie. Not much is known about their origins, with shepherds being more interested in working ability than in keeping pedigrees or stud books. The collie might have remained a humble, little-known herding dog, but fate had a different plan. Queen Victoria, who frequently vacationed in Scotland at Balmoral Castle, fell in love with collies in the 1860s. Royal patronage caused a demand for the breed. They went from being the helpmates of humble shepherds to the cherished companions of the wealthy. By 1877, collies were being exhibited in the Westminster Kennel Club show, and again they were taken up by wealthy dog lovers, including J.P. Morgan. Today, the collie ranks 38th among the breeds registered by the American Kennel Club. The Golden is one of the breeds created during the dog-loving Victorian era. The breeds in its background probably included a Yellow Retriever, the Tweed Water Spaniel, Wavy and Flat-Coated Retrievers, and a Red Setter. Golden Retrievers were first registered with the American Kennel Club in 1925 and were officially recognized as a breed in 1932. Since then, they've established themselves as versatile companions, hunting dogs and working dogs. Goldens are found doing search and rescue, animal-assisted therapy, arson detection, drug detection, and assistant work for people with disabilities. Their energy, enthusiasm, and intelligence makes them well-suited to learning and performing almost any task. The collie is a herding breed, which means he is smart, quick to learn, and very tuned in to his people. While he's nowhere near as intense as the Border Collie and the Australian Shepherd, the collie still needs daily exercise as well as training and play that will challenge his mind. Collies respond best to consistent, reward-based training, and they enjoy the attention that comes with performing, whether doing tricks or competing in agility, obedience, or herding events. The collie can also be an excellent therapy dog, tall enough to stand at the bedside for petting, with a calm and welcoming personality. On the downside, the collie is vocal with a bark that can be exceptionally irritating. If left to his own devices, he can become a nuisance barker. He's not trying to tell you that Tim is in the well, he's telling you that he's bored. The collie is family-oriented and should live in the home, not out in the backyard. He also has a tendency to nip at heels and play, another sign of his herding heritage. While it's interesting to see instinct in action, it's not a behavior that should be permitted. It can be frightening to children and annoying to everyone else, including other animals. Collies learn quickly and are eager to please, but they get bored with repetitive obedience training. Find different ways to change your routine and keep them interested. His skills as a herder require him to make some decisions independently of people. Learn to appreciate that independence and work with it, not against it. Before we continue, please consider hitting that like and subscribe button, as it would mean a lot. Thanks. Ask anyone about the defining characteristic of the Golden Retriever, and the answer you will always get is temperament. The hallmark of the Golden is his kind, gentle, eager to please nature. He craves affection and will seek it from strangers as well as his own family. Goldens are adaptable and people-oriented, and those characteristics are at the top of the list of reasons why people love them. Unfortunately, the breed's popularity has meant that careless or clueless people have begun churning out Goldens without any attempt to maintain their sweet, gentle disposition. Shyness and aggression can be problems, leading to fear-biting or unfriendliness towards people and other dogs. Proper Goldens love everyone, but that love for people will often translate into jumping as a form of greeting. Basic early obedience training is a must for these big, rambunctious dogs. Fortunately, Goldens are very easy to train, and a small investment of time when the dog is young will pay off when he's fully grown. He will readily sit on command, walk on a leash without pulling, and come when called. If not trained, socialize, and exercise daily, the good-natured exuberance of Goldens, especially as adolescents and young adults, can be overwhelming and even frightening to small children, despite the dog's best intentions to be friendly. Choose a Golden as a family dog only if you are prepared to supervise kids and the dog when they are together and make sure everyone plays nicely. It's normal for puppies to chase and bite and play, so you need to teach a Golden pup how to act around kids, as well as teach the kids how to play properly with the dog. All dogs have the potential to develop genetic health problems, just as all people have the potential to inherit a particular disease. Run and don't walk from any breeder who does not offer a health guarantee on puppies, who tells you that the breed is 100% healthy and has no known problems, or who tells you that her puppies are isolated from the main part of the household for health reasons. A reputable breeder will be honest and open about health problems in the breed and the incidents with which they occur in their lines. Collies can be affected by a number of genetic health problems, including multiple drug sensitivities from a mutation in a multi-drug resistant gene MDR1. Dogs with this mutation can have serious or fatal reactions to a number of common drugs, including the common heart failure preventive ivermectin and loperamide, a human antidiarrheal agent sometimes used in dogs. Screening not only your puppy's parents but also your dog for these conditions is a life-saving necessity. The test is simple and requires only a cheek swab. Eye problems are also of serious concern in this breed. One of the most intractable is progressive retinal atrophy. Collie eye anomaly is a group of eye disorders ranging from minor to serious. They are present at birth and may be detected in puppies as early as 5 to 8 weeks of age. Unfortunately, collies can also be affected by a number of health conditions for which there are no screening tests. These include epilepsy as well as a condition called bloat, in which the stomach expands with air. This can become a more serious condition, gastric torsion, if the stomach twists on itself, cutting off blood flow. Golden retrievers look beautiful, but are they healthy? An individual golden certainly can be, but the breed as a whole can be affected by a number of health problems. At the top of the list of health concerns in this breed is cancer. Some veterinarians go so far as to call Goldens cancer retrievers, and treatments for this disease can be emotionally and financially devastating. It's not known to what extent all these forms of cancer are genetic or exactly how they're transmitted from one generation to the next, but the sky-high rate of cancer in golden retrievers is suspected to be at least partially inherited. Goldens also suffer from a high incidence of the painful genetic hip deformity known as hip dysplasia, which develops when the head of the thigh bone doesn't fit properly onto the hip socket. Serious hip dysplasia can lead to crippling arthritis and requires costly surgical treatment. Golden retrievers can also have genetic elbow deformities. Eyes are another problem area in this breed, so make sure that the parents have been examined by a board-certified veterinary ophthalmologist and certified by the Canine Eye Registry Foundation. Before individual Goldens can be included in the Canine Health Information Center (CHIC), the Golden Retriever Club of America requires them to have hip and elbow evaluations from the Orthopedic Foundation for Animals or PennHip, an OFA cardiology exam, and an eye clearance from the Canine Eye Registry Foundation. You can search the OFA and CHIC website for yourself to see if a pup's parents are listed. Both varieties of collies have double coat, meaning they have a thick, softer undercoat and a thinner, flatter overcoat. The rough collie has a beautiful coat that looks like it needs significant care, but it doesn't. A thorough brushing every week or two will keep the coat healthy and tangle-free. The smooth collie's coat is a piece of cake to care for. Brush him weekly with a rubber curry brush or a soft slicker brush to remove dead hair. Rough collies go through a heavy shed twice a year called blowing coat. During this time, brush him daily to keep all the loose hair under control. The smooth collie doesn't blow his coat, but he sheds more throughout the year than the rough collie does. It takes some dedication to live with a golden retriever. The Golden's profuse coat requires regular brushing and bathing to remove debris and mats. While all dogs shed, Goldens do it with the same enthusiasm they bring to swimming and retrieving. You can keep it under control with daily brushing to remove the dead undercoat, but if shedding is a deal breaker at your house, this is not the breed for you. Like most retrievers, Goldens love water. When your Golden gets wet and he well, give him a thorough freshwater rinse to remove chlorine, salt, or lake muck from his fur, all of which can be drying or otherwise damaging to the coat. Keep his ears dry to prevent infections and use an ear cleaner recommended by your veterinarian after he goes swimming. The rest is basic care. Trim the nails as needed, usually once a month, and good dental hygiene is important, so brush the teeth frequently for good overall health and fresh breath. Check the ears weekly for dirt, redness, or a bad odor that can indicate an infection. If the ears look dirty, wipe them out with a cotton ball dampened with a gentle ear cleaner recommended by your veterinarian. It's best to introduce your dog to grooming at an early age so he will accept it gracefully. Alright guys, which one do you think you'll get? Tell me down in the comments.